Welcome to Victoria Rumble Room. It's a online news magazine show that likes to take a look at things that are going on in the West Coast, but we stretch across the country and around the globe. I'm Robin Adair, and talking about global, I have with me a global all-star, the spawn of Croatian immigration, John Jurisic. John, we've got so much to talk about. And what the heck? Let's start with Joe Biden. Joe Biden has taken a walk.
Let's talk about Joe Biden. Holy mackerel. News is flying at us at 1,000 bazillion miles an hour, isn't it? He's President Biden has finally come around to the idea that he's likely too old, likely too confused to be U.S. president for another term. He's a great president, but I agree. He's now stepping aside. Incidentally, I kind of hope maybe Justin Trudeau is taking a careful look at this moment in history, how it's galvanized energy, how it's renewed people's desire to vote. Down south, Trudeau's also massively unpopular. So perhaps his walk in the snow isn't that far off. Certainly, Joe Biden has provided considerable leadership and blazed a trail for other leaders.
He's blazed a trail, all right. John, I think he's definitely taken the right move here. I think it was really the only one available if you look at the opinion polls. And he's finally moved over for Kamala Harris, his vice president. So the question remains, can a mixed race woman have enough vote support to overcome the Donald for the White House? It's a big question. Can the Democrats hang on? And she'll certainly have support from women, from university-educated people across the United States. But what about young people? And what about the blue collar? Blue collar people have been supporting Trump in droves. And, they've been also flexing their collective muscle worldwide. The blue collar has really risen, I think, in the face of globalization and other factors. And it's going to play a part in this upcoming election.
You bet it is. It's fascinating. The analysis behind the demographics of who's going to vote I cannot wait. Notwithstanding all that, the energy is there. She's certainly galvanizing energy back into the Democrats. Blue collar voters are the key to any election, I believe, in any country. And according to the polls, these blue collar voters in red states still back Donald Trump in a big way. The Republicans have just wrapped up their convention. Weird convention anyway. And the Donald is pretty high in the national polls, likely influenced Biden's decision because Joe Biden is literally collapsing his support. Old Joe is just too old. Too bad. But Donald Trump is not so much younger, only 2 years younger. So Donald Trump is pretty old too. So now we have a battle between a woman in her prime against an old angry man with orange hair and orange face. Let's pray the American people have some common sense. But we're a long way to the finish line, aren't we? God help us if Trump comes back. Do you know why? Because he's no friend to Canada.
Those are very profound words. Donald Trump has not been a friend to Canada, and I do not look forward to his return in the White House, John. But let's shift over now. Let's shift over to BC politics because there's so much to talk about. Despite what you're hearing from the provincial government right now about all the money that's being poured into the healthcare system and all the doctors that are being hired and all the great things that are happening, we still have in this province nearly 1 million people who do not have a family doctor. We still have a lack of clinics where people can drop in and see a doctor or even see a nurse practitioner. And we still have massive waiting times at the various emergency rooms and hospitals across the province, up to 12 hours sitting in emergency. It's just crazy. And we now have had the BC Conservatives, as they build up towards the next provincial election, presenting a plan for BC's healthcare system. And it would add some private options to the system, a mixed system. They do this in Europe. A lot of European countries have systems just like that. So what do you think the response has been, JJ?
Well, it was pretty much immediate. David Eby and Health Minister Dix immediately went onto the attack in defense of public health care. And here's what Langford Wanda Fuca MLA Ravi Parmar had to say about the BC Conservative plan for change.
John Rustad held a press conference and he was having trouble talking about the particulars of his plan, but let me give you a big one. GDP spending targets, page 12. What he's proposing is $4.1 billion, $4.1 billion in cuts from our healthcare system at a time when we should be spending more money on healthcare to hire more doctors, hire more nurses, invest in the infrastructure, and ensure we have a quality public healthcare system. What does John Rustad want to do? He wants to privatize our healthcare system, and he wants to take $4.1 billion out of it.
So, Ravi Parmar on the attack. Is this true? If we went to this mixed system, would it be $4 billion being pulled out of the healthcare system? Would it mean a lot fewer services? Would it mean only the wealthy would benefit from the services and average Joes would still be in long lineups and not have access to medicine? So we want to find out whether these comments from Ravi Parmar are true or unfair. So we turn again to Tim Thielmann. He is the BC Conservative candidate for Victoria Beacon Hill. We've spoken to him before. Let's find out what he thinks. Let's zoom him in.
So we have a patients first healthcare model, and the heart of that model is guaranteed wait times for patients. So that means after you reach the medically determined target period for a procedure, the government will pay for you to go to a non-governmental clinic, either within BC or outside, to make sure you get the treatment you need within the time frames you need it. So that's the heart of the plan. As our plan states, this healthcare plan, Patients First healthcare plan, will actually require an initial increase in healthcare spending. Why? Well, it's obvious, because if you're going to start covering procedures that the NDP government to date has not been willing to pay for, they would rather allow patients to languish on wait lists, then it's going to cost more money. So instead of admitting that we are willing to spend more on healthcare in the interim to keep people from dying on healthcare wait lists, Ravi Parmar went to page 12 of our healthcare plan and made up a number that is not in the plan. So I reviewed the plan. I didn't see that number, and that's not because I'm legally blind. It's because the number's not there. And there's no reference to cuts in our plan, in the entire plan, because overall spending in healthcare will increase initially until we can find cost savings by switching or by moving funds from our current bloated and opaque government healthcare bureaucracy to frontline workers, doctors and nurses.
Yes.
So there's no cuts whatsoever. There's a shift in funding from
So we're arguing
bureaucrats.
We're arguing with NDP talking points that might not actually exist in the document. Excellent start. Let's stick with healthcare. Premier is trashing the idea of adding more private services, suggesting this is a threat to public healthcare. But on social media, you presented an interview with a friend in James Bay who recently spent 12 hours at Royal Jubilee Emergency before he could even see a doctor. It appears BC healthcare is a mess. I've heard horror stories like that all the time. So my question is, can we have a mixed system that's fair to everyone?
So right now we have nearly 1 million people without a family doctor. You have walk-in clinics that aren't walk-in clinics, they're lottery clinics. Maybe you get in, maybe you don't. And we have ERs that are bursting at the seams, including for Paul, who spent over 12 hours there. So obviously we need more capacity. This NDP government, because it's ideologically opposed to the private sector, won't let people who are dying on wait lists go and access the care that they need. So our government will maintain the single-payer universal healthcare option or a program, and your health card will cover the healthcare services that you need if you get those wait time target periods that are determined by medical professionals.
So, John, the bottom line out of these announcements is we need some change. We need something to happen. We still have all these problems and deficits in our healthcare system, all well and fine to throw darts at each other as we go towards an election. We're looking for some solutions and not something that's going to happen in 10 years. We need some immediate help. This is a big problem, and it's just not good enough. But You know, we still have other topics. Let's move on to something else again, John. And I think this is, of course, something that we'll be talking about for weeks and months ahead.
Likely years, because it hasn't been solved in years, and it is a direct result of a broken healthcare system. Let's move closer to home and talk about tents and homelessness on our streets and parks. I see new announcements from the City of Victoria that they're planning to shut down these camps. Right. After all, we just had a social worker kicked in the face, and something should be done. An all purpose alert was put on, and cops from all over Vancouver Island showed up. Well, I really wonder what the new plan will be. It sure doesn't sound like next steps have been very well thought out, eh?
Well, when you think about next steps, how about Jeremey Caradonna, who, of course, is on our Victoria board, our Victoria Council. He's a councillor, new to the job, one of the guys who was leading the charge for that 28% pay raise for council. Anyway, he's on to other things now around the homeless. He is saying he would like to talk to Justin Trudeau about bringing the Canadian Armed Forces onto the scene and creating peacekeepers to go in amongst the tent cities and the homeless to solve the problem. And you have to think this is a pretty outrageous idea, and it doesn't sound much better when you hear it directly from Mr. Caradonna.
Canadian peacekeepers to organize a domestic humanitarian mission, not only to Victoria's downtown core, but to all the downtown cores affected by homelessness, mental health, and addictions. This is a humanitarian crisis, and Canadian peacekeepers are well trained in dealing with humanitarian crises. It's just that the difference here is that this is a domestic issue, not a foreign one. We should treat this as though it is the crisis that it is. Right here in the city of Victoria, we have an armory over on Bay Street. It's an enormous building. I was in there not that long ago. It's a gigantic building. It's completely empty. Imagine if Canadian peacekeepers were helping out the unhoused, move them to the armory, get people triaged, get people stabilized, get them into treatment, get them into housing. If the housing doesn't exist, let's build it.
Well, talking about passing the buck on a local Victoria street, first of all, Bay Street Armory isn't empty. It's a parade ground and trains young men and women to serve in Canada's reserves. The role of the military, as far as we all knew, is not to act as a police or become social workers, particularly in our own country. And this is just a terrible idea. So are there better ideas out there? We asked former councillor Stephen Andrew for his take on the ongoing mess on our boulevards and parks.
And now joining us in the Victoria Rumble Room, once again, it's been a while, but great to have him back. Former city councillor, podcaster, broadcaster, journalist, you name it. Stephen Andrew, great to have you here.
Thanks for having me again.
And we have a lot to ask you about. I really want to get into the whole idea of homelessness, what has been done, and more importantly, what hasn't been done in Victoria. It's reflected in communities all over the province, what we've been going through. I think you can see it in Nanaimo, certainly see it in Greater Vancouver. So it's not an isolated problem, but we've certainly been dealing with it full on. And we've just had this terrible situation downtown. We had of course, tent cities are no mystery. We've had them since before COVID. In some ways, it got worse during COVID, but they haven't gone away since. Even though there have been houses built and all kinds of other programs in place, we still have tons of tents on Pandora, and things got out of hand. We had a social worker kicked in the face by somebody who got out of control. And it seems to me, Stephen, that it's just a terrible, terrible situation. What are your feelings?
Well, I mean, this is the second major issue on Pandora by the 900 block, which people associate with our place. And so I don't know if people remember, but a couple of years back when I was on council, there was a police officer that was run over by somebody who was homeless in a car. And that really had a life-altering experience, not just physically for him with his career, but also emotionally as well. I go back to 2008 when Alan Lowe was the mayor, and I was covering what then was known as the Mayor's Task Force to end homelessness, which is end homelessness, maybe just a catchy phrase, but certainly there, Perry Kendall, who was the BC medical health officer at the time, and the late Ted Hughes, who was a judge, a respected judge, and also the husband of Councillor Helen Hughes. were on that. They led this task force and they came up with a plan. And the plan showed that we should take the top 50 clients that were heavily using the healthcare system, the justice system, and we should deal with them on an individual basis and elevate them into homes, into treatment. And we just avoided that. We just ran from it the other direction with successive governments under local governments under Dean Fortin and also Lisa Helps. And I think that was a huge mistake because, as Julian Daly, the chief executive of Our Places, recently said, that it should be the plan if we want to get people off the street. And what we've been trying to do is come up with blanket solutions, figuring that it's going to succeed. And the other issue that I think that we have completely missed is that many of the people on the street, I'm not saying all of them, but many, majority of them, are there because of addiction issues. And all we've been doing really is focusing on harm reduction rather than dealing with intervention and treatment and enforcement where necessary. And I think that we've got to come up with the multi-pronged approach in dealing with this. If we don't, we just are not going to manage our way out of this. And so I really put the blame on the city. I put the blame on the province and the society as general. We're just not using the right tools to deal with this problem.
Stephen, I also support the fact. Great to have you back. Thank you. Amazing. And good luck with your podcast. I love listening to it. I think it's fair to say that folks could describe you as politically as a centrist, middle of the road, with some pro-business philosophies and ideas, but also a pro-people person and very much someone who stands with the disadvantaged. I'd say many of us are in that same place. So how does someone like yourself, who believes that we should support the addicts and mentally barriered people in tent cities and who live in the tent cities and on our streets, what kind of policies are therefore we need to be thinking about enacting, and are any of our political parties reflecting those views on these issues?
Well, I think my take, I'm just going to read the temperature of the room, as it were, in Victoria at least. I think people are fed up with what is seen as a very, and I quote, I don't use this as a political party, but a generic term, liberal approaches to dealing with addiction. I think that we have been there's a feeling, I think, that we've just been laying down and giving those that are addicted whatever they want, and the rest of the individuals are just cast to the side. And I think people are fed up with that. And I think that is why we are seeing such a huge shift politically on the provincial side. I'm not going to deal with federal because that's not really my area of expertise. But I'm seeing that shift and people saying, look, we've got to do something about it. What party is going to deal with this? What party is going to take a strong stand against the violence, the criminality, and also deal with the issues that are there? I mean, we've got to care for these people. The one thing is, I mean, you said, John, I care about it. It infuriates me when people say, well, it just cleared the streets or just forbid them from being on Pandora. Okay, let's take that to the next step. We do that. Where are they going to go? Where? So, it's insanity to keep coming up again with these blanket ideas. Let's go in and deal with it. But I do think, as I've said recently on social media, I think that we should resource to assist agencies such as Our Place to provide individual care, get the people off the street, put a moratorium, as we had during the pandemic, on camping on the streets. And we need some kind of, I think, coordinated continuum where people can get coordinated help and move them out. Because right now, all the agencies are dealing with these issues in silos. I mean, they say, yes, they do get together, but they're not. It needs to come under one umbrella. You get into a healthcare situation, you go to doctor number one, and he says, well, I can deal with this part of your health issues, but doctor number two can deal with something else. We're not doing that. We're just saying, okay, you show up at my door, I'll give you a room, and then they misbehave or they have a crisis, they get kicked to the street, and they go into door number two. So we've got to come up with a better way of dealing with it. So to me, I think that we need a coordinated approach, whether that be, I think the best way to come from the province.
It's interesting. We're talking province, but it's municipal. That's a background that you do have. You were a city councillor. We've just seen Marianne Alto. She's announced there's over $1 million now in place for an outreach center. It's going to be down in North Park, close to a school. They had a public meeting not too long ago. People were at that meeting quite concerned about this. One lady who lives right next to it said, who's going to protect me at night? Who's going to make it safe for me to go to my car park if this is right next to my, and there, she got some answers. And then somebody else said, well, you've come out with this proposal. It's a fait accompli. Why didn't you consult with us before? And I think the response she got was, well, if we'd consulted, would you have said yes? Which of course makes it sound like it was already a prearranged deal. How does City Hall work on these things, Stephen?
Well, I'll talk about this because I do know quite a bit about it. So all of this was done behind closed doors. Everything was done behind. There was no consultation. And I think the biggest issue that the community has on this, from those that I've spoken to, is that there's going to be consumption, meaning they will allow people to smoke up or ingest drugs at the location. Well, for a consumption site to be set up under Health Canada guidelines, they need an exemption. And there's a very specific set of guidelines that they have to meet. There's a specific set of consultation that they have to go through, and they simply haven't done it. And Solid, from what I'm hearing, is not, I don't think it has a great reputation. Everyone's saying it's low barrier here or no barrier. Again, I think this is part of the concern that communities and British Columbians are having, and say people who live in Victoria are having, is that their rights seem to be ignored for this section of the population. And nobody that I've spoken to disagrees that we need to be providing services and helping those individuals that are downtrodden, that are living rough. But people are saying it's got to be done in the appropriate location. They have to be run well, and they have to benefit the community. And that's why I think we need to talk about accountability. I mean, if you look at just on the salaries that they're paying to organizations such as Kool-Aid, who does a lot of great work. I mean, this will give you an idea of the kind of money that we're spending in this area right now. Their annual budget for wages is in excess of $20 million a year. Same for our places, in excess of $10 million. So there's obviously a lot of work that's going on there, and we're spending the money. Question is, are we spending it appropriately? What kind of successes are we having? And where can we find some efficiencies so that we can actually be more successful in that approach?
I should mention that we spoke to Stephen Andrew just before we heard from Jeremey Caradonna and his idea of bringing peacekeepers in to solve the homeless problem. It's the wrong deployment for the Canadian Armed Forces. And if Donald Trump becomes president again, he's going to demand that Canada gets more people into uniform. He's saying that not at least putting 2% of our GDP into defense and our commitments with NATO is not acceptable. And there are people in Canada who feel the same way. Maybe that'd be a benefit to Victoria, because we are the home, of course, of the Western Fleet, and we have a lot of armed forces folks all up and down Vancouver Island. We've got the Air Force arm up in Comox. It would be a benefit, but at the same time, not a benefit to put these people into peacekeeping roles. We're going to talk more about that. We'll talk more about the homeless and drug addiction and all those things, but it's time to wrap this show, John. And I just want to again thank our over 2 million viewers for joining us on the Rumble Room. We really appreciate your support. And if you happen to be on Twitter right now, X. I guess some people still call it X, which is the new name that Elon Musk placed on it. Please retweet Facebook, like the show. Anyway, there's a lot of platforms. John, you want to review that quickly, and we'll take it away.
Absolutely. It's fun hearing how people like you and I reflect on whether one should use X or Twitter. It happens on TV. I wonder at some point, will that ever end? But I have to say, reiterating your point, we get a lot of action on X. And so please consider retweeting, sharing, joining X, Facebook, YouTube, our audio podcast, also TikTok and Instagram. We're all over the place, and each one of them has some unique audiences that listen to our show. And man, do we ever live in a crazy world these days. I can't believe it. Stuff that happened 2 weeks ago now feels like 2 years ago. So we're trying our very best to cover this in our own unique way, right? So we're peeling back the onion on whatever we can. Once again, so glad that you're joining us. As always, I am your Croatian sensation, Yanni Judicic, and wondering in the depth of these summer months how Justin Trudeau can take a walk in the snow in the middle of sun.
Well, the great news is we have ice rinks around the country, Johnny. We just take them down to a rink, we throw them in one of those snow banks where they clean up the ice, and there you go. That'd solve the problem. I'm Robin Adair, and rumble on.